We're in video number 3 about the final meeting before a patient takes their MAID, medical aid in dying medication. It is really important to know where the medication is being stored. Hopefully this has already been received well ahead of time, well ahead of the meeting, and do know who has the responsibility of bringing the medication and the proper chosen diluent to the appointment. These medications are received in a powder form, then they're mixed with a small amount of fluid. The patient can choose the fluid, but it's often recommended to mix it with a sweetened juice such as apple or pineapple, as the taste of the medication is extremely bitter. Consider having popsicles or sorbet available, because offering a popsicle or several bites of sorbet prior to drinking the medication can somewhat numb the taste receptors, and then it can also be offered after the medication is ingested, which minimizes some of the bitterness. The patient should also be offered this choice. If you're drinking it, it's suggested to drink through a straw because it forces the fluid back to the back of the oral cavity, and it can also help to minimize the taste of bitterness. The powder is generally mixed in 3 to 4 ounces of fluid, and it's really important. You must remind your patient that the entire amount must be finished within 2 minutes. If they can't drink the full amount within that time frame, they might fall asleep before getting enough of the medication to actually cause their desired death. I've had a couple of patients and instances when they weren't sure about whether they could drink that much over 2 minutes. So we offered them a practice session, and they used water or juice, and we actually used a stopwatch to assure that they could swallow it all within 2 minutes. Okay, the stomach should be empty prior to taking the medication so it will be absorbed. So just like prior to surgery, it's better that there's no food eaten after the evening before, like what we call NPO, nothing by mouth. And this can be one of the fun parts of the meeting, as friends and family help the patient choose their last meal, something that is a favorite and can provide a celebration. Regarding food, it's really even important to provide for sustenance of the family or attendees during the actual vigil, since it is unknown how long the dying process may take. So do consider some of their likes and desires during the meeting and get those supplies available. Is there an anti-anxiety plan? In other words, is there an attendee who feels they can calm and be able to help support other guests in the room who may be overcome emotionally during the event?